professionals to connect as peers, to learn from each other, and to gain tools to be able to help others, as well as elevating the peer support specialist professionals and their role on interprofessional teams, and really treating peer support specialists as co-equal partners in these different kinds of spaces. Okay, go to the next one. Thank you, Tricia. So wanted to share with you all some different kinds of examples of what our initial sessions have looked like. And I'd be interested too, if anybody who's been on Navigators wants to chime in about their experiences with this, but to just kind of give you a sense of what Navigators is all about. So our first 6 sessions, and we usually are meeting on a monthly basis, virtual meetings, totally free, no expectations in terms of how you're coming into that space. You can come in on your phone. If you're in your mobile office, you're doing other things, no expectations in terms of how you're showing up. We're coming together on a monthly basis, and we often will have, in addition to our content sessions, review sessions where we're having an opportunity to practice and apply some of the skills that we come up with. And I also have a PhD student who is evaluating Navigators of the Commonwealth, so that's been pretty cool. So our topics are things like the foundations of effective engagement, balancing suspicion of need versus bias and assumptions. So how do we navigate that line between assumptions of whether someone needs help and bias and assumptions, right? If we're looking at someone who might need help and making assumptions about what their needs are based on how they show up, how they present, how they talk, how can we balance bias with really engaging folks around their self-determined needs? We had a whole session on the power of the first impression, how to greet every patient to lead to engagement. And then at one of our favorite sessions that we had from the overall group was how to move away from checklists when we're administering screeners and assessments, trauma-informed approaches in everyday interactions, just to give you an idea of some of the topics. And every month we focus on a topic that the group has voted on that we want to focus on in the previous month. So for example, in January, our session was on when helpers need help, navigating and responding to peer burnout. And our topic for February that was voted on by the group was trust is the foundation for community engagement. So what happens there is that Valerie works on putting together all of our content. We have a peer support specialist who does all of our graphic design. And then we put together this, I think, a really fun experience where folks are coming into the space, not because they have to be, because we want to connect. So the way that we kind of create that vibe is that every session, in addition to having a topic, also has a theme. So when we were talking about peer support, burnout, and navigating burnout and those kinds of dynamics in January, our theme was whitewater rafting. How do we navigate on our little boats together and paddle in tandem? For our very first session on foundations of effective engagement, we were all pirates, and we had music, and everybody uses this. It's a name generator that Taryn puts together, our peer support specialist puts together, where you can generate a thematic name that you can kind of give yourself. So people really have fun with it, with the theme. And we always have all of our slides and music and name generator on both the theme and the topic. So we're kind of, again, creating kind of a vibe for each of the sessions there. Okay, so go on to the next slide here, and we may not need all of the slides here. So some of the stuff just to be aware of in terms of who's typically attending, just a screenshot from last year. We had 131 people who attended in April from all across Kentucky. And in April, we did a little count of how many people had attended all 3 of the sessions of the previous 3 months, and we had 46 folks who had been at all 3 sessions, which is pretty amazing, given that we are given that we are not, this is not required. No one has to be there. We're not doing any continuing education credits at this point. People just are wanting that kind of opportunity to connect. We have folks from healthcare, behavioral health, folks working in the criminal legal system, and of course, school and education, a lot of friskies in the group, youth services, harm reduction, and substance use treatment. And then I just love this quote because I think it really gets at what Navigators is all about. Someone said, I always enjoy these sessions. I get great information, and they are just uplifting in a way that many of my meetings are not these days. Please keep this energy. I desperately need more of this in my day. So that's great. And I think we can probably stop the PowerPoint at this point, Tricia, and see if I don't want to put Aruna or anybody who's been in the sessions. I think Laura has attended in the past here. I don't want to put anybody on the spot, but I was curious if anybody has any thoughts that you'd like to share about what Navigators is all about and what you've gotten out of it, and why you thought about it might be helpful for this group to know about. Oh, you're muted, Aruna. I can see you talking. All the tech issues today, and I still can't make my name anything but Marga, but I promise I'm Margaret McGladrey. I promise. I'll do some fussing around here too on my end. So what I'll put out in the chat as Aruna is negotiating with her sound here is a link to our registration and a little blurb about Navigators. And I will send this to you all as a follow-up thing as well here. I think we've got it all pulled up. All right, this is great. Let me get the little blurb here to cooperate. Okay, great. So I'd love if you want to invite anybody else who might be interested, and I'll put out in the chat. And feel free, Aruna, if your sound isn't cooperating to just put anything in the chat and I will speak that out loud. But you can click on that link in the little blurb I put together to register for Navigators of the Commonwealth there. Or if you want me to just get you added and put your email out in the chat, that's great. I can do that as well. Thanks, Aruna. That's great. So when you feel stuck, I always know I can rely on the Navigators team for effective strategies. Right, exactly. So we're really trying to get people thinking about and connecting the dots with different skills and get out of those stuck places, because chances are, if like you haven't encountered that specific situation or that specific kind of challenge, there's someone in the room who has, right? So it's not just building connections with the folks who are facilitating on my team, but also all of the other helpers in the room. We always do a breakout session, so you get kind of that opportunity to connect with the group. Kind of the flow of the sessions is that we all come in, we figure out what the theme is, everybody gets in the mood with the music, and we have our name generators, all that. We typically do like an icebreaker on the topic so that we're all getting kind of thinking about what the topic is ahead. And then we'll share a couple of different slides and ideas. I usually start the conversation with what are a few different things from the research that we might want to know. So like, for example, when we were talking about burnout strategies, I had some slides on the research about how common burnout is and how it manifests in different ways in terms of like moral distress and secondary trauma and those kinds of things. And then we go into breakout rooms and have at least 10 to 15 minutes where you're really able to connect with other navigators based on a couple of different discussion prompts. And then we come out all back together to reflect on what the breakouts involved and work through often cases like Aruna was saying out in the chat here. We usually are sharing real life stories and management, how to address that, how people have dealt with different kinds of situations. And really that, like Aruna was saying, we're looking at tools and strategies for the case studies. This isn't just academic, right? It's really getting into what would I say in this situation? How would I say it? How can I manage my own emotions and thoughts? And how do I draw on my supports to be able to show up for folks as a helper as best that I can and connect with other helpers who might have other pieces of the puzzle there. So I feel like we really hit on a hot topic with the peer burnout topic. I think we had like 80 people live. Folks were really passionate about it because I think we're all feeling the pinch right now in, January. That was the longest year of our lives, right? January 2026 is a joke that I've heard before. So it's really become a valuable opportunity for us, everybody to come together around areas. We all are in such different roles, and it can be so easy to feel stuck and that you're on your own. And that was one of our kind of key takeaways from our last session was like, I really am not alone in how I'm feeling with these burnout situations that I'm seeing. Totally, like Aruna just said, I feel supported and not alone. Like an opportunity to connect and recharge and feel like we have kind of that shared vision. So you're Frisky operating in this school district, right? But you're able to talk with other helpers who are dealing with the exact same situations, but maybe from their position as a community health worker out in Paducah, right? But it's all what are the strategies that work when we're helping folks who are coming to us with different basic needs, emotional needs, all of the different things that show up in our casework, and be able to effectively meet them where we are and take care of ourselves as helpers. So that's kind of the flow of it. An hour every month, and again, and you also get all the slides afterward, and you can use those however you want. I know that several folks have been using some of the slides and exercises that we've come up with in like case staffing and different kinds of team meetings and that kind of thing. So the materials that we've developed are really kind of yours, open source, to be able to take and run with in whatever way you see fit, even if it's just like an exercise or a specific idea that you're like, I could use this in my own practice or bring this to the rest of my team. It's all fair game, and for the help to help the helpers, right? My husband is a professor of Chinese here at UK, and whenever he tries to describe my job to people, he's like, "Oh, you're kind of like a case." You're like a social worker for the social workers, right? And I'm like, yeah, that's kind of it, right? But we need the space where we can, helpers can be helped, and to be able to connect those different kinds of dots. And maybe last thing I'll say before seeing if there's any questions that folks have, I also have some information about resource navigation. We did a whole session on Connect Resources and how to use some of the online platforms that now exist in Kentucky for finding those local resources that you might not be aware of, but you find someone in front of you who has very specific kinds of needs. How can you find those other helpers that might be able to take up a piece of the puzzle for a client that you're trying to help? So I can review some of that information today too, if we have time, you all are interested in learning about that. But want to make sure we have some time for any questions or additional reflections about Navigators of the Commonwealth, and of course, invite you all to join us. Any questions, Friskies? Wonderful. Well, I hope, again, if you have any trouble with signing up for Navigators, you can just email me. You can send me your email address, and I will get you all signed up. Make sure you have all of that info. That's my contact. And I'm also just your general phone a friend nerd. I've been working with Nydia on some different kinds of ideas of service learning projects. If there are things that you think that a college student might be able to help with, we have public health practicum students who are able to do different kinds of service learning opportunities. So we're starting to explore that. Nydia and I, possibilities for our students to come alongside with the Friskies. Public health students, you're like, why would they be involved with any of this kind of resource navigation stuff? Increasingly, that's the role of public health, is to help coordinate all these systems and sectors that don't talk with each other. So we have students who are prepared to help with doing like resource fairs, thinking about how you might be able to get the right resources to the right people at the right time. Students who might be able to help you with doing those different kinds of legwork pieces. So you can always contact me about that, or anything else that you might want to explore around research, or the different ways our students might be able to help with what you have going with your centers. And I know we have both family resource folks and youth services folks. We're more than happy to work in both elementary and high school settings. But yeah, we're here to help, and again, love to support the helpers in this work. And I feel like Friskies are something that every state should have. I brag on them all the time when I go to different conferences, that you all are really kind of the counterparts for the education system of our helpers and other parts of, and often are the folks that are really working with those other professionals, right? Because you're the teachers that are in the classroom, the folks that you're supporting in the school maybe don't have that kind of background that you all do in resource navigation. Okay. Well, Trisha, do we have time for me to talk a little bit about Connect Resources and maybe get your help? I might be able to screen share that. I was thinking that might also be helpful to this group, but it might not cooperate here.
Sure.
Great. Let me see if this is going to cooperate. Maybe not. Oh, it's so annoying. Well, I really like the visuals I have associated with this, but I also will. Why don't we just take a look at the? I'm not going to be able to screen share. It doesn't seem like because I can't share those slides. Oh, wonderful, Nydia. Thank you. Yes, sessions have been very insightful and engaging. That's wonderful to hear. Yes, would love to have you all there. And again, as not just an opportunity for you all to be able to receive that information, but also for the folks who are attending Navigator sessions to learn about what Friskies do and how they can connect with you in their day-to-day work. So that kind of networking opportunity for you all to be teachers. That's often how we think about it, is everybody in that room is bringing so much expertise as being a helping professional. We're all learners, we're all teachers in that space for sure. Okay, so let me pull up here because I can't use my deck. I wanted to make sure my current soapbox these days in working with helpers is making sure that when we're thinking about, okay, do I need to make another resource guide, right? To keep track of my local resources, where I might be able to refer my families that I'm working with. Before creating another resource guide, it may be helpful to take a look at what is out there on Connect Resources. So Connect Resources is a platform that Team Kentucky, the cabinet, has developed using 211 data from the United Way to try to put together a comprehensive community resource guide covering all of the different social needs, as well as all of the different counties in Kentucky. So if you click on that link there, folks can, oh, perfect. Thank you so much. That's great. Trisha, I can kind of walk us through all of the pieces here without my slides. So this is what the website looks like and what you can do here. And it's separate from like the connectors, right? So you think about Connect, it's often thinking about getting folks onto the healthcare marketplace, Medicare, Medicaid, and the connectors being the folks who help people with getting that health insurance. Of course, that is super, super important. But Connect Resources is like the new kid on the block, right? Of a resource directory that is backed up again by all this 211 data, so you don't have to start from scratch when you're looking for local resources or building your directory there. So what you can do is, like for example, if you wanted to, there's a video in the middle, right, where you can learn about even more about Connect Resources, how it's built, what it does. But Trisha, if you want to navigate, for example, to the family tile there and explore that, all the different areas for families, and then you enter in a zip code wherever you're at. Great. And what's your role in the family? And so with the role there, you can do all different kinds, like the family. And then if you look at the drop down there, Trisha, thank you so much for real time doing this with me. What else shows up in that drop down? And if you could just click submit, that would be great.
So in the drop, childcare during COVID-19, support groups, financial help, biological parent, foster parent, and young children. Which would you like me?
Awesome. Let's do family, but you can see all of those different kinds of categories and roles you can look at, right? And you could toggle between them. Thanks, Trisha.
Of course.
So it's thinking about it right now. Thinking. And of course, you can see out on the side here that you can toggle between different roles if you want to. But what it will pop up for you here is different kinds of resources by category. So parenting skills classes, what are the different organizations that offer them? And you see kind of a couple of highlights from the Nest and Omni Visions. And so maybe if you wouldn't mind, Trisha, so you can keep kind of scrolling down here to find other kinds of resources. But if you clicked on, just to show them what the tile has for the Nest, if you clicked on that connect button for the Nest, thank you. Oh, it wants to create an account to do that. Okay. I don't know if it's, oh, don't have to worry about doing all of that, Trisha. and go back there. So the idea with an account is that you can keep track of all of your resources and referrals and all that kind of stuff. So don't want to have to belabor you going through all those pieces. But what you would see if you hold up the tile there is lots of detailed information about the nest, including all of the contact information. What are the services? What are the eligibility criteria? What are the hours there? Everything that you would need to know as a helper trying to connect one of your clients to that information. And so it's a really nice way to also be able to filter by what type of resources you might be looking at. If you look at the checklist out there. So really everything that you kind of think about wanting to use when you're thinking about like a search engine like Amazon, right? Different kinds of filters that you can apply to the resources. And then if you don't mind to go back to the home page, Trisha, I'll put that link back in the chat here. And go ahead and scroll down so you can see all of the different tiles available. So you can kind of enter into the directory here based on where you want to start with the types of needs that you might be addressing. So everything impacted by substance use, foster care, birth to 5 years, my situation is different, right? All the different kinds of entry points there graphically. That's awesome. Thank you. Thank you. Okay, and what else was I going to highlight about Connect resources? Oh, yeah. So again, the important thing here is that you don't have to start from scratch in finding those local resources that you may not already be familiar with. And the other website that I like to share with helpers is the other state-run website called Find Help Now KY that is specific to substance use disorder treatment. So you can find where to get naloxone, where recovery housing is available, treatment down to the bed level. Like, so I'm trying to find a place in Lexington that offers Suboxone. Do you have that availability at this organization or this agency? You can pull all of that up. So want to make sure always that helpers have this information where you can start so you don't have to start from scratch. There is, of course, information about 988 there as well. At our last Navigators session, we talked about the fact that University of Kentucky has free suicide prevention training called Question, Persuade, Refer. So if you're interested in getting signed up for that training as well, I will, if you put your, email me, send along your information and say, I'm interested in learning more about the navigation pages or about Navigators or about Question, Persuade, Response, then I'll get you hooked up with the right resources. But for today, just wanted to make sure that you were aware of not only Navigators, but some of those platforms that are being used by the state. And right now, there's a lot going on with like the healthcare enterprises using lots of different kinds of platforms for how to manage social needs referrals and coordinate between organizations. But a lot of those platforms involve us as community-based organizations paying for them, which is kind of ridiculous given that the state is running these different kinds of databases. So a little bit of a plug for our public resources there. And have folks come across Find Help Now? Have you all used Connect Resources or Find Help Now in the past? Yeah. So those are great tools in your work as helpers to be able to connect folks to local, relevant, available resources. But again, I am always here as your phone a friend if you're looking to go deeper with any of these topics. Again, just shoot me an email if you'd like to be added to Navigators. You can also click on that Zoom link I sent before and register yourself. No problems. Aruna says she's used and referred Connect. That's amazing. Yeah, you have the resources with that detailed info, right? So everything all in one place, and to be able to kind of go between, instead of having to look everything up on separate tabs, you can compare things side by side in terms of the features that you're looking for. So that's fantastic. All right. Any other questions or comments about, you all are a very resourceful bunch. So I'm always trying to, again, get resources to the resourceful people. And we would love to have even more of you all join us on Navigators. I love all of the engagement, Nydia and Aruna, and all of those who've been part of Navigators before. Would love to see you again. Yes. My email here is great. Yes. Shoot me a note. tell me what you're interested in, and I will get you all the deets. For the resource navigation stuff, I'll send you my full slide deck that I couldn't screen share today, so you can start with that. And then just say if you want to do Navigators, I'll send you all those details. And then also let me know if you want that question, persuade, respond, suicide prevention training. It's all online, totally free from UK Healthcare. I'll get you hooked up with that as well.
Thank you, Dr. McGladrey. We so appreciate you taking. Did anybody have, I got another question in the chat. Targeted case management?
Yes. So I do not offer a targeted case management training, but I can connect you to the folks who do on campus. I would love to get you connected with them, Phyllis. If you just shoot me a note, then I will copy you over to, it's the Center for Training and something at the College of Social Work, and they'll be able to get you all hooked up with that. I will make an introduction. Would love to do that. They train all the TAP workers in the state and have some great TCM resources there.
Perfect.
Yes, absolutely. Yeah, please just, so I have your emails. Just shoot me an email to that margaret.mcgladrey@uky.edu and let me know what you're interested in. And then I will send you to the right place. That'll be perfect. Desiree, there, you've got my email there in the chat. Just shoot me a note. Let me know what you're interested in, and I will make it so.
Have any other questions? Or, as always, you can always reach out, but please reach out to. I feel like she will get you hooked up with whatever you may need. Yes, perfect. Okay, thank you again, Dr. McLeod. Sorry about the technical difficulties, but we made it. Everybody
roll with it, right? It's never perfect as a helper. We just we help each other, right, in these different situations to patch it all together. Thank you all so much. It's great to see you all. We'll look forward to seeing you at Navigators, and our next session will be on the 28th on building trust as the foundation for community engagement. See you there.
Thank you. Everybody stay safe.